Great. Okay, I can see people entering the room, so we'll give people a few more moments to enter the link, get settled. For everyone here right now, as a reminder that there is a Q&A function, and I will be monitoring that, so feel free to type in questions as they come up. We've left a solid chunk of time at the end for questions. Hopefully, there'll be a lively discussion going on between the panelists. Um, but hopefully, you're in the right place if you're here for person-centered use of artificial intelligence for health literacy. We have a panel that spans health communication, medicine, tech. It's going to be a really great, multifaceted view of the risks and opportunities. Um, I think we can take this moment for each of us to introduce ourselves in the order we're going to present. So I'll start off. My name is, you can call me Sam. I'm a PhD candidate at the Harvard Chan School of Public Health. My dissertation focuses on how to expand on concepts of organizational health literacy through emerging technologies and social media and digital media. And I will be presenting a little bit of some of my preliminary research findings today. And I can pass it off to Vishal to introduce herself.
Hi, all. My name is Vishala Mishra. I'm a trained physician and an informatics fellow at Duke. And I'd be presenting on how best to incorporate patient voices in AI development. Thank you.
And I'm Tracy Meehan. I'm the Director of Research, Translation, and Communication for the Center for Injury Research and Policy at Nationwide Children's Hospital. And I help all of our researchers take their research out of the journals into the public through social media, digital channels, traditional media. But I've also really recently been focusing on how we can utilize AI effectively in our messaging. So I will be talking about some tips and tricks on how to do that. And I'm also a subject matter expert on AI for IHA. With that, I'll pass it off.
Hi, I'm Temisha Salai, thrilled to be here. I run a AI strategy consulting company called Subtextive. I have been an AI practitioner for over 2 decades. Yes, that goes back to before the turn of the century. AI is a long-lived field already, and I'll be talking about some of the underpinnings of AI and how we might be able to use those to help you build a compass for navigating AI and your usage of it through a person-centered lens. So thank you very much. I'm really looking forward to being here. Thanks.
Great. As you can see, we have a wide variety of perspectives here in the panel. And so with that, I'll get started summarizing some of the learning objectives for this panel. And if there's anything in here that's particularly interesting, again, you have the Q&A to enter in some questions via text that I'll bring back up toward the Q&A panel session at the end. So we have a few key learning objectives. One is to define some concepts related to artificial intelligence. So hopefully you have those to put in your pocket and some resources to refer to. Discuss opportunities and challenges associated with AI to enhance health communication, including ethical considerations, technical limitations, potential benefits. We have a lot of great data and concrete examples to show you. And critique the use of AI technologies in generating health-related messages, focusing on health communication equity and reliability. So hopefully you'll have a multifaceted view, and you can take that with you into your professional practice and in your own communication. So I'll start off talking about machine learning in health literacy assessments of materials. So this is one of the topics that I'm exploring in my dissertation. And I wanted to start off giving you a few definitions. There's a lot of ways to tackle this work. And as Hamish just said, it is has a long history behind it. But here's a couple of things that artificial intelligence tends to mean. First is that it is different in different contexts. You'll hear it differently in a tech space versus in a marketing agency versus maybe how it's been used over time. I'm using Melanie Mitchell's book on this, and you'll see the reference soon. But one way to think about it is very practical. Like a computer program that can perform a task as well or better than humans. And that you can tell there's a few subjective, squishy words in there. For example, in decades past, the idea that a computer could beat someone at chess might have signaled intelligence, but today we don't really think that anymore because there's a lot more of a rules-based computational approach. But just a reminder that sort of that benchmark of what artificial intelligence is in popular and practical usage changes over time. And another way to think about it is a more computer science, theoretical, abstract perspective, slightly of studying intelligence by attempting to synthesizing it. And for more on that, I do recommend an intro book by Melanie Mitchell, Artificial Intelligence, A Guide for Thinking Humans. And I wanted to bring up a few examples of ways that we might already interact with AI in our daily lives, such as, let's say, autocomplete when we're searching on Google or when we're typing, sending text messages, spam filters in our Gmail inboxes, facial filters on Instagram or TikTok or any other app, personalized content feeds on social media platforms, and more recently, things like ChatGPT and image generation tools as well that are built into more and more platforms. This is an example from Canva. But there's some emerging ways of interacting with AI. I'm, for this presentation, focusing specifically on machine learning. And one way you can think about that is using computers to detect patterns in data and then make predictions based on those patterns. Those predictions are based on algorithms or a set of instructions to complete a task. In this case, the task I'm interested in is labeling a public health agency tweet with a pass or fail rating for a index item from the CDC Clear Communication Index. And in this case, it's supervised because I'm using labeled data to train a computer model to detect patterns, but you can read more. I find this a helpful one-sheet explainer from the Department of Energy. The DOE explains machine learning. And you might be wondering what that labeled data looks like. For this project, I was using labels from the CDC Clear Communication Index. So for example, I was developing one model to try to predict this label on public health agency tweets. Do both the main message and the call to action use the active voice? We had trained raters labeling tweets with yes or no, and we use that data to train models and use a separate set of data to test them out on and evaluate how accurate they are. I was interested in this because I think supervised machine learning could help scale health literacy assessments like the CDC Clear Communication Index. If you've ever used it, it involves a complex patterns of unknown variables, right? If I had to tell you to rate a message as having a call to action or not, you might be able to define some aspects of what you're looking for, but you might not be able to break it down into a neat formula like we have for reading grade level or some other more rules-based approaches. So I think that makes it an interesting question to try to address. A useful feature of some of these assessments, like the CCI, is that they're binary labels. So it's a neat classification task. It either has the thing or it doesn't. And practically speaking, if you've ever used it, it can be a very repetitive, time-intensive task. And there's room for a tool, I think, to examine, would it be suitable to use a modeling tool to try to help speed up some aspects of that process or provide supplementary information to a more in-depth analysis. But going into this, I knew supervised machine learning comes with risks. For example, missing topics, authors, or audiences in the training data. So in my example, I'm looking at tweets from US state public health agencies. Most are active on Twitter still, but let's say some like Massachusetts are far more active than others. There's statistical methods to try to correct for that so that the model isn't just predicting what the Massachusetts Public Health Department would say about a tweet, but or is not just tailored to the topics that they write about. But also, right, these are tweets online in a social media context. They're not necessarily reaching the like hardest to reach populations, and they're not necessarily intended to. So there's going to be some limits in the data themselves. there's also, when we're thinking about the long-term lifespan of a tool like this, a model that can predict these scores. Language changes and sometimes really quickly. And all of us here lived through that with the COVID-19 pandemic, how quickly new lexicon was introduced that now we're all familiar with, that maybe 5 years ago, practically no one was, unless you were in medicine. And then the other thing that I'm particularly interested in and sort of worry about is the incentive to potentially write for algorithms or models instead of communities. If we tie an assessment score to funding or to something like the Plain Language Act of 2010, right? While there might be good intentions behind that, are we unintentionally incentivizing someone to just pass a test versus reach a specific, possibly underserved audience that they're interested in? And so here's some takeaways of what I learned by training models to predict CDC Clear Communication Index labels on US Public Health Agency tweets. So we had a training data set of about 1,800 tweets with labels from 8 different items. I'm going to focus on a couple here. And we tested those models on a held out sample of about 200 tweets. So relatively small for a machine learning project with that caveat, but relatively big for a health literacy data set. One thing that I'm gleaming from this preliminary results are that assessing performance sounds straightforward, and there are a lot of metrics you can use that have an objective, well-defined meaning, but the act of choosing which metrics and deciding what kinds of errors matter is very subjective, come down to very human decisions. And so one example I have, so there's a CDC index item that asks, does this tweet have a behavioral recommendation? And I'm comparing 2 models, and there's, let's say, one measure of thinking about alignment between the machine predictions and the human scores. Via this metric, the 2 models look pretty similar. Via this metric, they start to differentiate. And within each of those metrics are different assumptions about what is the underlying mechanism of how ratings are produced and what are we more interested in, where they don't align or where they do align. And similarly, I have for those same 2 models, sensitivity and specificity, which might sound familiar, like a true positive rate, true negative rate. And again, we can look at these and see there's different performances based on the different metrics. Are we more interested in correctly identifying tweets with a behavioral recommendation and maybe casting too wide of a net, or are we more interested in correctly identifying ones that don't have a behavioral recommendation? And then to confuse the waters more, right, there's a whole suite of metrics from more of the natural language processing or computer science side that we may be less familiar with in public health. And so we also have to start to get a feel for what those means if we're going to interact with these models. I also found a trade-off between model performance and explainability. So for example, I used one approach that looks a little bit like logistic regression, where every tweet is represented just in word counts. And so for the CCI item that's trying to predict, does this tweet have a call to action? Those results I'm able to examine and interpret in a pretty straightforward way, where I'm able to find these words like visit, learn, read, and your predict a call to action. And that might make intuitive sense. And that might, this is something we can examine, and the model isn't as good at predicting as some other options, but it is a lot more explainable. And so there's a trade-off there that I found in this domain specifically, compared to, I also trained a more flexible and more accurate model based off of neural network approach. And there are ways to audit the model, but I would still say it is a pretty relative black box. So that's another case where, do the scores and labels and the accuracy there matter, or does the ability to explain it matter? And relative to each other, how much? And then finally, I found some pathways potentially for algorithmic unfairness. So I looked at tweets that models across the board consistently performed the worst on, and they had things like current events or mentions of specific geographic communities by name or mentions of resources in ASL or American Sign Language. And this, there's a few ways to think about this. One of the ways I think about this is in terms of the data, right? Where there weren't that many mentions of American Sign Language, but when it was there, right, American is used in a pretty different context for describing ASL compared to other places where health agencies use that word. Sign and language also. And then as I was examining those tweets, they also seemed to be written in these longer form sentences. So as one example, how there might be some, this might be accurately representing the fact that in this data set, mentions of ASL tend to be in these complex sentences that were hard for raters to label to begin with and agree on. But that's a problematic association because we don't want to repeat that elsewhere and just say, oh, a mention of American Sign Language means it's not meeting these guidelines, right? That's not the conclusion we want to come to. But then we have to think about how to prevent that from being baked into an assessment process or evaluation process. So in conclusion, what I'm finding so far in my dissertation is that supervised machine learning does, I still believe, show promise in health literacy assessments, providing shallow but like wide knowledge in a way that information that we can't exactly get through manual assessments. But it does come with serious risks that I think will not always be acceptable in the face of health inequities. And so we have to think about what is the implication of using it long-term across a diverse set of populations. I'll leave this link up for a moment if you want to connect with me on LinkedIn or elsewhere, and then I will pass it off to Vishala to move on to the next presentation. Do you think you need to unmute? And then...
Oh, okay. Yes, thank you. This works better. Thanks, Sam. So it's wonderful to be with you all today. So I would like to start my talk by stating the obvious. AI can benefit healthcare in many ways. So that could be by improving diagnosis, improving treatment, improving quality, efficiency, cost, being able to provide personalized care. And yet, we have many concerns about risks, bias, and potential worsening of health inequities. Next slide, please. So I would like to first spend some time giving a brief introduction about the discipline of human-centered AI. So that combines research on AI algorithms with user experience design methods. And the goal is to shape technologies that can amplify, augment, empower, and enhance human performance. Next slide, please. For human-centered AI to lead to positive and beneficial health outcomes, it must be fair, unbiased, safe, ethically applied, and at the service of consumers, which then means that responsible AI requires us to have a better understanding of how consumers engage with AI systems, their perceptions of AI and how it works, trust in AI results, barriers for its adoption, the impact of AI explanations and interpretability, and it must also provide ways for consumers to be in the loop with the learning process of AI and potential AI biases and how to mitigate them. Next slide, please. So as a trained physician informaticist and digital health equity researcher, I've learned from several patients about the potential of AI in delivering equitable care. The first way I would like to think about it is AI is one technology that we've implemented in healthcare. It is certainly not the first, and it won't be the last. The focus of this talk will remain patient portals and health information networks, but I would like to reiterate that for the past decade, we have seen the emergence and adoption of several technologies in healthcare, and we will continue to see that. while digital redlining, by which I mean fair and just opportunities to engage with and benefit from these tools, remains a prominent issue, the question today is, can we learn from the past and align health equity goals by including patient voices, especially traditionally marginalized communities, in co-creation and implementation of technology in medicine? So this slide is really going to be the focus of my talk. And as part of a recent community engagement and health equity focus groups, which was conducted for the design and implementation of health information networks and AI-powered patient portals, uh, we had some themes that emerged. We learned the obvious fact, which is awareness and use of AI broadly and LLM specifically varies widely. For example, several patient representatives that I interacted with have begun using large language models to brainstorm, and they have developed widely circulated patient-specific advice newsletters to encourage, educate, empower individuals uh, to access, understand healthcare research findings, improve collaborations with their healthcare providers, and advocate for themselves. On the other hand, several other patients have reported feeling uncomfortable with the use of AI, bemoaning the loss of human touch and that rapid deployment of chatbots that confuse them when the answers arrive not in the typical style of their care team, some of whom they have a decade-long relationship with. So the central theme remains that several patients, and most patients, want the use of AI to enhance rather than replace human interactions in healthcare. For example, prepare for appointments, more efficient health information search optimization in their preferred language, summarize important healthcare information after an appointment, facilitate communication between appointments. So going back to these key themes that emerged, the first one was prioritizing accessibility and inclusivity from the inception through the rollout of healthcare AI. What this meant, for example, was ensure that the health information platform caters to diverse needs. So include accessibility for people with disabilities. So by doing things like closed captioning, alternative text descriptions, offering language preferences by providing culturally competent language beyond just English, and being respectful of different literacy levels by using plain language and visual aids. The other aspect was that accessibility is an evolving process, and we need to be able to continuously adapt to user needs. So moving on to the second theme that emerged was consumer engagement and partnership. Apart from the bare minimum and the absolute obvious point, which is making sure that we are receiving patient perspectives. And notice I said perspectives and not the singular, because there is not one archetype of a patient. There was also a request to prioritize collaboration with families of patients who are likely to be care providers and diverse community representatives, including community health workers who patients might interact with in search of resources, and faith leaders throughout the platform's development, implementation, and evaluation. So I would just like to mention that simply because this is the right thing to do, we should be doing it. But then for healthcare systems to continue to develop resources towards this, we also have evidence that apart from being the right thing to do, there is so much science to back up the claim that engagement with patients, their families, and the community, incorporating the lived experience of patients in these quality and safety initiatives, dramatically improves population health. The other point that came up was ensuring fair compensation for community experts who provide their knowledge and expertise towards the development of the AI platform. And that is something that I would definitely like to highlight. And that was seen as a way to foster trust, relevance, and make efforts towards cultural humility. So the third theme that came up was, well, how do we build trust and credibility? The most important point that came up here was addressing pre-existing organizational distrust, acknowledging historical harms in marginalized communities proactively. The second theme that came up was finding a way to transparently communicate how patient data was protected, how it was being used, providing patient education, so AI literacy, especially about how AI is being used to generate the health content, but also going beyond that. The third theme that came up was enhancing user trust by displaying any provider endorsements. Because patients do believe that their healthcare providers or would like to discuss this with their healthcare providers and do trust their providers, but also empowering users to independently assess the credibility of the information. And then considering the needs of the users with limited technological competency and providing resources for them to differentiate between misinformation and science-backed information. The last theme, which is especially relevant to the conference today about health literacy, is how do we make information actionable? And one perspective was, well, we should be able to link users to relevant local um, healthcare resources, and so that the gap between the information dissemination and practical healthcare outcomes can be bridged. And patients also preferred that these platforms could be integrated into clinical settings, uh, and they thought that would be one way to make the information actionable for all users, and particularly those from marginalized communities. Um, so one of the key themes to sustaining a long-term digital health usage is being able to create a personalized approach that consumers can identify with. While it is more cumbersome and time consuming to develop such a platform, because it needs having us performing an analysis of individual user characteristics and then evaluation of their responses to different forms of data presentation engagement, perhaps there is a role to use AI to automate some of this, and utilize AI to build digital health tools that can be used as a population health tool. So Sam, would you please, I don't think I have the time to go over these slides, and I can take them over in the question and answer session. But I would just like to quickly conclude by saying that the key themes that we've explored so far: accessibility, community engagement, trust, and actionable information, underscore the importance of embedding health equity principles into any AI-powered tool. Now, that could be a health information network or a patient portal. And so this goes back to using formative user research in developing these solutions. So by which I mean making sure that we understand user needs, and we seek to empower these diverse populations, and thus we can turn patients from passive recipients to active participants. I Yeah, so Sam, I would like to use these slides in a question answer, and I think I would, and we can skip over to the next presenter. Thanks, Sam.
Awesome. This has been fascinating already. I love talking about this topic and hearing about it. So my slides are going to be a little bit of a different angle. We've been hearing about some ways it's being used. I personally believe that AI is here. It's not going away. So I feel like it is our duty to learn about these programs, whether you decide you're going to use them personally or not. We've already heard about how it's being implemented in different places. We know platforms like Epic and Patient Interaction Portal, they're using it, they're implementing it. Your institutions where you are have them. The people you work with, our patients, our communities are starting to use these programs. So it is up to us to learn about them so we know how to talk about them and advise about them. So I'm going to give you some tips and tricks on what that could look like moving forward. Okay, so yep, perfect. So I think I saw this quote and it kind of helped me think about why staying up to date matters. John Ayers said in a talk recently, 100 million people have ChatGPT on their phone and are asking questions right now. So people are going to use these whether we are using them or not. And I cannot tell you, even in the past 2 weeks, the number of people I've talked to who said people around me aren't using it. And then when I challenged them to ask the people around them, they came back to me, every single one of them, and said, oh, people are using this and I didn't realize it. So people are using them. And it is up to us to think about that. And you know, I've had these conversations. I talk all around the United States, and there's a lot of resistance from our people in our field to use it. But our patients and our communities are. And so, you know, learning about it will help us counsel them and know what we need to think about and what some of the limitations we've already heard about and that we're going to hear about here next to think about it. Okay, so what does that look like? This is a survey that was conducted by Slack, so it is not at all generalizable, but I thought it was fascinating. I heard it during a presentation that they had. And they collected data in March of 2024. And of the data that they collected, they found that AI use at work had risen 60% just since September of 2023. And of the 32% of people who had used AI for work, half were using it at least weekly. So it's growing and people are starting to explore and use it a little bit more. The other, you know, one of the interesting things that I thought that they brought up too was AI adoption is going to accelerate as we see Gen Z and Alpha enter the workforce more. They are already using it. They are thinking about it. It's becoming a part of what they do. So it is going to be up to us to think about it so we don't fall behind and we know how to use it. Okay, so I think it's important for us as we think about that. We're kind of all in that space now, right? We're going to start thinking about it. I do think it's going to be important to think about what challenges AI can solve for us. We've seen with different technologies in the past, people like adopt it because everybody else is doing it. And I think there needs to be some caution around that. There are so many tools out there. Some are not great and some should not be used and have a lot of bias or potential risks in them. So we need to be really thoughtful about the programs that we are using. We need to make sure that the ones that we're using are protecting our patient data, are not stealing from people in ways that they shouldn't, and that there's ethical use around them. But once we have learned about that and are asking questions and are thinking about it, we also need to make sure that we're using the tool that's right for the job. Everybody knows about ChatGPT, and ChatGPT can do a lot of great things, and I'm going to give some examples, but it also is not good for everything. And so we need to think about making sure we're matching the tool and know that there are other tools that are out there that could maybe be better for what it is that we're looking for. We also, you know, embrace learning. Like I I do think we get busy, right? Everybody has our jobs. We're doing our day to day. But if we embrace learning about AI, we can start to do it in small ways. I'm going to show you how you can do that. But there are a ton of resources out there that we can read, that we can watch, that we can practice doing, where we start to learn what this looks like. And we can learn, okay, if I put this question in, it's going to give me this biased answer. How can I adjust that? How can I think about that? How can we challenge these programs to be better and mitigate the risk on our own in the way that we're approaching these? Okay, so in terms of specifics, we're going to start really digging in now. So what can I do? I want to learn about this. What does this look like? There are AI communities already out there. You can look online for some of what those look like. You can find them on LinkedIn. You can find them on Facebook. You can find them, even in X, different places like that. You can see if your organization has any groups related to it. I invited myself to join our institution's AI committee. When I joined, it was mostly IT people. And I bring this whole other perspective, but it has opened up the conversation and gotten our entire institution to think about things differently when I bring my angle in. Before I was there, they didn't know what health literacy specialists were. And now I've gotten them thinking about, oh, we need to think about this in a different way, right? So think about what organizations are out there. And Tamisha is going to be able to share some specifics of ones that she recommends as well, which I think is fantastic. There's newsletters out there that have some great summaries. There are hashtags that you can look at, things like AI in healthcare, health tech, digital health. Look for different things and see if any of it resonates with you. There are more and more and more conferences and webinars and YouTube videos, podcasts that are coming out about AI in general, but also about AI in healthcare. So all of those are things that we can think about. The other thing that we want to do is practice. It can be scary, but sign up for one of them, and you can do the free version. Just start. ChatGPT is a good one. There, you can use the free version and just start playing. I now have ChatGPT open all the time, and I am constantly asking it questions. You can even ask ChatGPT to help you learn how to use ChatGPT for whatever your topic is, right? You can ask it that question and you can have conversations with it and go back and forth and learn better. So I encourage all of you to pick one and start practicing and see what that might look like. You can also use it for things like research. If that's a more comfortable place for you to start, you can use it to help you think about how you're generating your questions or how you're doing your lit review. These are by no means the only ones out there, but I thought I'd share these two because they're ones that I'm really hearing are good for research and that a lot of researchers are starting to use. So Perplexity is kind of a little bit more like the ChatGPT model, but it has a academic research focus mode that you can turn on, and it searches academic databases like PubMed, and it comes with citations, which the free version of ChatGPT does not. So I would definitely recommend taking a look at that. The other one is Elicit. Sam, I think there's a video with that one, so it may, yeah, there you go. So this one is more like for lit reviews. So if you use Elicit, it is based on their own AI model that they train specifically for research tasks. And it does things like put details from papers into organized tables like you're seeing here. It can identify themes and concepts across multiple papers. You can see from this video, it does things like saves a PDF. It can list the year of the research, the number of citations the paper has, the number of participants, population characteristics, even tools used to measure constructs, and so many more things that you can pick. So again, with all AI, you need to double check everything that is put out by these programs, but these two in specific have been trained specifically for research, so they can be a good place to start. If you want to look more into the LLMs, you can pick, there are a variety of different sources. Most people have heard of ChatGPT, but there's Copilot and Gemini and, different Llama and different resources, and just start asking it questions. What are you doing in your job today? Could those programs help. I've asked it things about, tell me about the health disparities around this particular topic. Tell me behavior theories I could use to create messaging around this topic. I've even used it to create campaign hashtags. I was stuck on a hashtag for a campaign, and for weeks I couldn't come up with one. And somebody said, you use ChatGPT for everything else, ask it. And in 30 seconds, I had my campaign hashtag. Why didn't I do that before, right? So thinking about that, I've started to use it for images. You have to be very careful with the images. They are incredibly biased in many cases, but you can learn prompting, and there are resources out there that can help you be better as a prompt engineer to specifically ask it for certain things. And some of the images I've been able to create have opened the door for what I can do in terms of showing diversity and equity in different populations in ways that I can't get on stock photo sites. So as a health educator, it's opening some big doors for me. So just start trying it and see what your mind can unlock and what we can do. Okay, in terms of content creation, these are, again, by no means the only options. They're ones that I have used. Vion Go is a software program that actually creates videos. And what I like about Vion is you have to pay for it, so it is not free. But it has a prompting platform that is like ChatGPT. I have created educational videos by using 3-sentence prompts. Create a video for me on, and you fill it in, and it creates it in under 2 minutes, and it comes out like that. And you can edit the script and things like that, but the speed at which you can create videos, you can change the characters, so you can make it look all different kinds of ways. You can change the scene. It even has up to 70 different languages and dialects that you can translate in. Again, I would never use the translation exactly as it is, but if I can take a script in English and a script that's been translated to a translator for a quick comparison, it's much cheaper and more effective. And the budget I would have to do that, I can now translate 3 or 4 videos for the same amount of money, right? So there's things like that that are on the market. Canva is another platform I know many of us use. It now has a Magic Studio that is fantastic. I have created entire health communication campaigns in Canva using their Magic Studios. Absolutely worth taking a look at. If you are not aware of it, it is incredibly fantastic. I wanted to just do a little shout out. I listened to a webinar last week that was absolutely fantastic. That was a case study where Better Health Connect used AI to develop a health campaign from start to finish in 30 minutes. And they did everything from using Perplexity to do research on behavior theory and some of the challenges their population of interest might have around this topic. They used ChatGPT to create a script and images. And they even used it to create a dissemination and distribution plan. And then they tested it, and it was so impressive. I was blown away. I put the link here. It's also in the Health Literacy Solutions Center. There's a chat there as well. So definitely recommend taking a look at that. I thought it was really cool to see how they did that. But there's more and more case studies starting to come out about that. I'm also super excited to talk about the AI Solutions Hub at IHA, which just launched this month. And I applaud Michael and IHA for thinking about and embracing early the fact that AI is here, and we do want to think about it. And so the AI Solutions Hub now is this place where we can start having these conversations. There's already great conversations that are starting to happen. They're posting resources and blogs and webinars and all of these other kinds of things that you can start to see there. And I encourage all of us to really embrace that and go there for questions and have a conversation. And part of that AI Solutions Hub I'm super excited about is we started what we're calling a Year of AI Challenge. And every week there is going to be a new task that you can do that will help you learn about AI and what I like to call bite-sized chunks. So we know everybody's busy, and we know this can be overwhelming. We know many in our field are already overwhelmed. So these are going to be really small tasks that you can start to do every week to learn. And it's going to rotate through a read something, watch something, try something, and go social. So it'll kind of rotate through that. And we'll link to articles, books, blog posts, videos, things like that. We'll give you little things that you can use to try with different programs or different things, and how to start talking about it with other people. So I hope all of you will join us in that journey. And at the end of the year, we'll all know AI that much better and be able to talk about it and advocate for best ways to do that. So please join me in that. And we'll have lots more discussion, but that is a great place to get started. And I hope you all will join me, and I'm excited to hear what Timothy has to say next.
Great, thanks, Tracy. I'm going to go ahead and share my screen because I like to drive my own slides. So everybody should be able to see this. We're still in the same deck, but the slide should say subtextive AI underpinnings to help navigate usage for person-centered AI. I'm thrilled to be here, and I definitely want to reiterate the focus here. There's been lots of great stuff shared by Sam, Vishala, Tracy. Hopefully this is not super repetitive. What I'm going to be doing is taking a quick look at AI underpinnings, like how do the mechanics of this work? And hopefully that will lead us to a compass that you can use for navigating AI in a person-centered way. And so Sam touched on this a little bit, but let's just start with what is AI? And I'm not going to define it. I'm going to just describe it, okay? It's really getting self-operating automation like computer programs and robots to do things that have otherwise required human intelligence. And it's a huge field. Machine learning is a big part of it. So is image processing and computer vision, natural language processing, which is my background, and knowledge representation, robotics. There are a lot of fields in the AI landscape. Most current AI does include some form of machine learning today. And this is important for us to consider as we think about AI and how we engage with it in a person-centered way. Let's look at what machine learning is. Sam touched on this, but just to reiterate, machine learning is using statistical and mathematical algorithms to learn and generalize over patterns in data to be able to carry out tasks without precise instructions. So we're generalizing over patterns that we've seen, right? And we're doing that statistically and mathematically. And math and stats are wonderful, and they're not people. So we have to think about that, right? And you're familiar with AI applications, right? It's everything from self-driving cars to Google Translate to the chatbots, ChatGPT, Claude, search engines, software coding co-pilots, credit scoring systems, even your movie recommendations on Netflix or Hulu are powered by AI. And what's important to keep in mind about these kinds of applications is they're a lot more like a puppy than they are like a toaster. Okay, systems like this need care and feeding on an ongoing basis, and they need constant monitoring too, right? You don't just let them go on their own for long periods of time. So I want to look at the basics of how AI works so that hopefully this gets surfaced a little bit more for folks. The basics of machine learning, it doesn't matter what kind of machine learning it is. You may have heard terms like deep learning or neural networks, classical machine learning, supervised, unsupervised, doesn't matter. All machine learning systems require data as input. All of them, every single one of them. And that input data is called training data. And that is what the algorithms learn from. That is what they are building mathematical models from. It is that training data that they use to generate patterns. Some machine learning systems do this explicitly with human guidance. That's some of what Sam was talking about, supervised learning. Give it labeled input. We see, hey, guess. Can you guess this label? Some of them do them through more unsupervised techniques. And a lot of the large language models out there use unsupervised techniques, at least in the beginning, to create the foundation models. Now, down the road, there is more input from humans, which we'll talk about in a second. But these models that get generated, that represent these patterns in data that have been created using math and statistics, they're the things that produce outputs in these systems. And sometimes that happens alongside supporting artifacts, but in general, the model has a lot of power here. And here is an extremely simplified picture of how this works, okay? Some people love a nice visual. Look, this is really a simple task. Recommend an article or product, right? And so we have training data, which can be the content catalog. It can include browsing history, user profiles, audience data, click data, a whole bunch of data gets thrown against an algorithm, a model gets created, okay? There's always model tuning that takes place. And then that model, once it's been tuned and seems to be ready for prime time, along with other artifacts that might help guide the model in certain cases. Like, for example, if you use Google as a search engine, you may notice that sometimes you get ads on Google. And, you know, if somebody puts in a prompt about suicide, there's a rule that says, do not show ads. Show a public service announcement, okay? So these kinds of other artifacts are in play to help guide systems. And then you have a user who's been looking at content, looking at, you know, shoes, who knows, and the system wants to make a recommendation. What should I recommend? We're going to use this model and these other artifacts to guide this. Now, as Sam mentioned, here's where that care and feeding comes in. Well, the world changes. You know, all of a sudden there's a new topic. There's new movies out there. There's new shoes. There's new ways to talk about new research that helps us, new techniques in healthcare. And all of a sudden we have new training data, which means we need to retrain things. We also have an algorithm that's constantly evolving, right? You know, we tend not to want to leave these algorithms alone because we always think that they can do better, right? And so when the algorithm changes, that's also going to change the model. And as end users of these systems, you typically don't have control over the algorithm, and you sometimes don't have control over the training data. And what I want to bring up here, we're not focusing specifically on large language models in this talk, this panel presentation, but I do want to shout out here, because there's such a big part of the conversation today with AI, that they are also built using machine learning. Yes, it is a very sophisticated and fancy kind of machine learning. These algorithms are incredible, right? And the models they generate are huge. They're enormous. However, the fundamentals of how they are built is the same as for other machine learning systems. They are built using training data, and the novel outputs that they produce are actually outputs that are statistically likely based on the patterns that were learned from the training data, okay? And so this is really important when we think about a person-centered approach to AI, right? What is in that training data and what does it represent? And is it representative of the people and use cases and needs that I have for AI? And this is basically the same picture. And my little joke here is it's not drawn to scale, because I did make the training data bigger and the algorithm bigger and the model bigger, but it's still not big enough compared to the first picture, right? These things dwarf more classical machine learning approaches. But what I want to call out here is that the process is the same. And what I've done here is called out more explicitly model tuning, because this is a more explicit part of interacting with large language models in particular. And if you are an end user using systems like ChatGPT or Claude or Perplexity or whatever, it's also a place where you have a lot more opportunities to interact with the model, and it presents some levers for you. Okay. And we'll talk a little bit about that in a second. You know, there are other artifacts that can go along with these models as well. If you've heard of retrieval augmented generation, this puts like a knowledge base or a knowledge graph in play with the model to help constrain and fact check basically the outputs of the model. Okay, so how can we take those underpinnings and start building a person-centered compass from what we know about how this works? And the first thing I would say with any AI you're using, it doesn't matter what it is understand what AI you're using. What are you using? Why are you using it? What constitutes as AI? That's why I went through that slide of, hey, here are familiar AI applications, because I will have people come to me and say, hey, you know, we want to put Google Translate on all of our glossaries and open it up because we want accessibility in all of the 140 languages or whatever Google Translate handles. And it's like, well, you need to understand that that's AI and think about what impact that's going to have on the content that you're processing with it. Okay. So just, you know, consider the basics of your AI tool, understand where it sits in your workflows and processes, and raise cross-functional awareness about the AI that you care about for health literacy. Ask questions and consider choices or alternatives. There are trade-offs in using AI. Sometimes, yes, it'll give you improved performance, increased productivity, all kinds of things. However, it may represent unacceptable risks or negative impacts for your work. And so do what you can to understand the trade-offs and have that conversation, whether it's with yourself or with others in your organization or others in your field. Work backwards. I think that this is hugely important, and it speaks to a lot of what Vishala was talking about. Think about the outputs that you want and what you are trying to achieve with those outputs. Who is consuming it? Who is going to use the outputs of these systems, and what are they supposed to be able to do with it? What action should they be able to take? And as part of that as well, and what are your criteria for appropriateness and quality of those outputs to uphold consumers taking those actions? And this absolutely requires a principled approach, and it requires doing the hard work of actually designing and modeling what makes an output good, what an ideal output looks like, and understanding who is using it and who needs to be represented and what that needs to include. So as part of that, I would recommend, and this sounds really obvious, it's silly, but proceed sensibly and responsibly, okay? Look to existing precedents. Use the scientific method. Have a hypothesis about what you expect to get. Review results. And absolutely start with, you know, Tracy used the phrase bite-sized pieces, me too. Start small and build up incrementally. Don't start by trying to boil the ocean here, okay? Just take it one step at a time and think about what you're doing. Understand where AI falls short. What is it that you want AI to do that it isn't doing well or well enough? And what are the issues that you're seeing? And what are the impact of those issues? If you can build a data-driven typology of the issues that you're seeing, or based on the projected impact of these shortfalls, that will really help, especially if you can focus on the what, right? Because that what goes back to, who am I doing this for? Who is that person that I'm trying to reach? And I want to speak again, large language models, they're back here, you know, they're here to stay. They're a big part of the conversation. I do want to point out that prompt engineering and instruction tuning are some aspects of model tuning that can help with certain kinds of shortfalls with large language models, because both of these techniques help provide context for the large language model that it may otherwise be missing, especially if it's an off-the-shelf model like ChatGPT or Claude that was not tuned for your usage and application. However, those things can't fix all large language model shortfalls. And this is something to be very aware of as a risk. Those kinds of techniques cannot help you with hallucinations and inaccuracies. They cannot help you with lack of domain knowledge, such as a lack of specialized vocabulary for certain fields. And they cannot help you with training data issues that may introduce bias or equity or representation issues. You may need other techniques that would require engineering or architectural support, like more robust fine-tuning, as I mentioned, retrieval augmented generation, or knowledge graphs to help you overcome or get through or mitigate some of those shortfalls. Codify your practices of use and policies. Once you figure out what is working, write it down, have those best practices and guidelines, create your checklists, and importantly, provide techniques for identifying inaccuracies in AI output. Have mechanisms to report harmful outputs and negative changes in behavior. And this includes when you see that and you're not busy being adversarial towards the AI. We need all of the negative and harmful outputs to be reported. And again, I just stress also, Tracy brought it up, I'm going to bring it up again, provide and encourage regular training. That can't stop. You know, an analogy I've heard is think of AI as a new intern, right? You know, they need guidance, they need scaffolding. You really wouldn't take a new intern's work and just ship it to your CEO. You would always check it. You might ask for improvements. You might use it as a springboard for your own work. So a simple practice here in best practices is what Tracy already said. I'm going to say it again, though. Check their work. That is your responsibility to navigating AI through a person-centered lens. Develop evaluation frameworks. Sam talked about this. This is definitely tricky. And you know, this may be something that you need to ask an expert to help you with, but it's hugely important because again, these systems are going to change over time. And if you've got them plugged in and are going to be using them over the long haul, you need to be able to benchmark them, right? And how are they performing on certain kinds of data and in certain cases? And while it's great to share anecdotal insights, systematic data-driven insights are going to go a lot further to helping you understand what's going on and understanding both the risks and opportunities that you're facing with the AI you're using. Vishala talked about this. I'm going to talk about it too. Build trust. This is hugely important in that person-centered equation. Inform people about the AI you're using. Be transparent about it. And if you walk the walk with your AI policies and practices, that will help you a lot in maintaining that trust moving forward. Vishala talked about this as well. Data and fair and transparent data practices are essential for trust with AI. So definitely understand how data is being used in the system, what data is being collected, how it is being collected, and what it is being used for, right? And also consider how representative the data is and what that could mean to you. Tracy talked about this, stay up to date and be informed. This is a very rapidly evolving field. We understand it can feel like you're drinking from a fire hose. Please don't let that be a barrier to you finding some trusted resources that work for you. It doesn't have to be everything out there, and staying up to date with that. I've listed some here that I'm very partial to. I think they're doing some really good work in responsible and person-centered AI. Finally, and this goes back to a lot of what Vishala was talking about as well, practice people plus AI. Humans are essential to this equation, and we need their expertise and humanity. That can't go away. So build practices out of the gate that can cultivate effective human-in-the-loop techniques and establish that culture of people plus AI, not AI instead of people. And I think that wraps it up. Sorry, I went a little bit long. Thank you very much. I'm going to turn it back over to Sam for Q&A.
Great. Thanks so much, everyone, for participating. We got a few questions in the chat already that I saw Tracy and Vishala respond to. Just a quick recap, right? Overall, we had this presentation that started with me giving some insight into a kind of application of AI that might be coming down the pipeline, right? It's not hard to imagine a software that tells you, it can tell you if your public health messages would pass the CDC Clear Communication Index. And I pointed out some of the issues that and questions that I can talk about very transparently and openly because I'm doing academic research and it's not under any sort of like private paywall or intellectual property, but that you might not have access to elsewhere. Vishala talked about community needs and responsibility and things like building trust and involving community members and compensating people for their time. And again, these are not things that there's necessarily a clear model for from other industries where that might not be the top priority, like it might be when we're thinking about health equity. Tracy talked about a lot of tangible tips to keep up with professional tools now, and Tamisha had a great tying it together with some underpinnings of AI itself. So feel free, everyone, to put some more questions into the chat, but there's one from an anonymous attendee that I thought would be great to open with. We have, with algorithms in mind, do you believe AI can be overall less biased than our individual perspectives in areas such as consulting? So I'd love for Tamisha or perhaps Tracy to take a quick start to that question.
I'm actually still thinking about it, Sam. I'm trying to put the question in context. Okay, so the algorithms are statistical and mathematical, right? So in many ways, they're going to represent what's in the data, right? However, the way that those algorithms are built may themselves be biased, right? In terms of what they favor in seeing those patterns and deriving those patterns in the data. So, I'm not sure quite where the consulting part comes in here. But, we're always looking to other perspectives, right? In all the work that we do, including from other fields. And I think that if AI and the algorithmic side of it leans into, what we can learn from, for example, human cognition, and take away from other fields in, whether they're in AI or not, that inform us about that human perspective, right? And can help us model it better. The algorithms themselves will become less biased over time. However, there continues to be a huge problem with representation and bias and equity in the training data itself because of the sheer enormity of data that is required with this new generation of AI. And we know that not everybody is out there on Twitter or X, right? Not everybody is out there on Facebook. We have, lumpy representation, I guess that's maybe a good way to phrase it, within the World Wide Web, which has become a big source of data. Even if we look at, data within walled gardens, some people may use those systems more than others, which is going to cause a skew in the outputs that get presented. So I don't know if that answers the question, sort of a little rambly, but, I'm not really sure. Right. I guess this is it. Anything that is human created, and algorithms definitely are subject to bias. Right. And so the more eyeballs we have on it and the more perspectives and diversity we can bring into that process, the less biased things will become. But I don't think we will ever do away with it altogether, unfortunately.
Yeah, I'll just add my 2 cents. I totally agree with what you said. And I work at a hospital, so there's lots of discussion about what do our patients think about this. And I've read some research that patients actually, some at least, think that their diagnoses and things may be, the AI isn't as biased as a human could be. If you look at me, you come with your biases, right? But exactly what you said in terms of the biases are actually potentially built into the program. So I think that piece people forget about sometimes. the data that is being trained on comes with biases and stereotypes in it. And in many cases, we don't know what those sources it was trained on are. So we have to kind of, as long as we're aware of that and cautious and be thinking about it and continuing to ask the questions, I think there's ways we can work around it or make it better as it grows, but I'm
And
not sure it comes with less bias.
yeah, yeah, and you know, Tracy, I mean, that's a good point. And I think part of it is also just remembering it's easy to forget that it's bias, right? And so just reminding ourselves to take it with a grain of salt, right? And to think about that. And again, that diversity of perspectives and getting more humans involved in providing that feedback and considering those outputs, and the process of how the algorithms are developed, right, is hugely important.
Okay. And I saw Vishala typing. I wasn't sure if you wanted to add anything verbally or not.
Yeah, so I think I was just gonna reiterate what was already said, but I was trying to type out a response to the question, but then I wondered if the question was very specific to consulting. Obviously, that threw me off too. But I do generally believe that in involving a wide wide range of perspectives from the outset would probably helps us consider the social ethical implications better. It is never going to go away. It is important to consider it at each stage. Obviously, it's important to think about the data, to think about the data annotation, to think about, to think about everything that goes into model design. But but yes, I think I'm broadly optimistic that taking a human-centered design approach and involving a wide variety of people, stakeholders, consumers, definitely a wider variety than we have in the past, is the way forward. Because AI is not going away.
And you know, Vishala, you mentioned something I completely concur, 100%. Plus 1, 1, 1, 1, 1, right? But and I also want to add here, you mentioned something in your presentation that I think is really important and also overlooked, which was paying community members and advocates to help improve these systems so that it is equitable, right? And I think that this is a huge piece that I'm now going to throw my industry under the bus, okay? Because I really, really dislike this aspect of it. The engineers who build the algorithms and train the models make piles of money. And the people who have to create the data and annotate the data, which is, as you saw, absolutely essential. You have no model without data, okay? Are paid peanuts. Right. I mean, these are people who are in the United States being paid, between $15 and $25
And
an
are
hour
exposed to
often,
multiple risks.
and are exposed to multiple risks. And it's extremely hard work. If you've ever annotated data, you know this. It's extremely hard to set all of that up. And so that piece of the equation, getting the industry to shift to more equitable frameworks for the entire life cycle of AI development, is hugely important. And I think those shifts, start with people in roles that are outside of technology pushing for it, honestly, because tech is what it is, and everybody else has to stand up and say, no, that's unacceptable, right? And to make choices, ethical choices about what tools you use and why, and
Yes,
when.
and exactly. And at this point, Sam, if you could pull up those slides that I was trying to save for Q&A, I was particularly sure I was going over my time. But yes, this brings in right to the discussion that we are having. So the 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 thing that I would like to bring up is it comes from a consumer health informatics work group discussion this past Thursday. And Sam, let me see. Just go to the slide. Just go to slide before. Yeah. So this concerns this special issue. So one of my colleagues from the Consumer Health Informatics Work Group, Dr. Della Grando, co-edited this special volume about human-centered artificial intelligence for One Health. And in the editorial, of course, it is, the role of AI in the future is not to replace the users, but to empower them. And the one thing that Adela brought up during the workgroup sessions was that each article that they had received was about physicians being involved in human-centered AI development, which let me say is not entirely novel at this point, and we are seeing a lot of work like this come out, but it's relatively novel in the large scheme of things. And they didn't receive a single submission for this volume that was specific to patient voices or anybody apart from physician voice. So that was one thing that Adela brought up. The other thing that she brought up was a comment by Ben Schneiderman, who is a pioneer in the field of HCI. And he commented specifically, and I'm quoting, since I'm deeply concerned about suggesting that humans and AI systems collaborate, he said, I respect your choice of the wording, but I prefer to strongly distinguish between humans and machines. I feel that doing so makes clear human responsibility morally and legally for actions taken by machines in their control. I'm always thinking of AI developers who need to be reminded that they can design a human system to be used as a tool rather than a pseudo-human collaborator, because they are vastly different systems. And that goes back to the point that we need to think very carefully about the problems that we are trying to solve and design systems accordingly. And that's the right way to do things. And not the other way around. So yes.
Well, I think there is one request here to, I think, also elaborate specifically on users who may have low health literacy. So I think I'll add on one angle here. My background is in social and behavioral sciences, so I will paste this book in the chat if you happen to have time for a book. Ruha Benjamin, Race After Technology. And I think one thing that Ruha Benjamin describes that I think is helpful for this topic is that social systems that produce racial inequalities or other inequalities produce the housing data, the language, the communication, all the training data that we have, right, has been shaped by these structural factors that we also might know as like social or political determinants of health. And so I think I'm pretty pessimistic that like these tools that are also developed in that system and their application in these health systems that are also part of these systemic inequalities, like without significant intervention and focus, will be able to work like particularly well for, let's say, people with low health literacy or people with multiple people facing multiple health inequities and communities that are currently underserved. So I think that's a real risk that I see with health communication that might be shaped by AI, that a lot of the training data is going to come from systems that already serve wealthier, healthier people best. And without a lot of specific effort, it's going to be hard to undo that. So I think we can fold this in. We have two questions. One on how do you recommend balancing the very real external harms of generative AI, like environmental impact, art theft, et cetera, with the potential help that it can provide? And then Also, can you provide examples of how equitable engagement of community members, patients, and other consumers would look like, especially for those with varying health literacy? So we have two routes. How do we balance the harms and the potential? And then what does it actually look like to engage communities?
So I might jump in to answer the second question first. One thing that I discovered recently was I've mentioned Epic. So it's one of the patient portal platforms, right? And I learned that they were building all of this research and all of these tools that they're building into their programs without ever talking to patients and getting feedback from patients. So one way, we can have these conversations is when we hear stuff like that, it is up to us to challenge them. How do we do this? How do we make sure that you're involving the patients? Make sure you're testing it with the patients and keep talking to them. As health literacy specialists, I've heard many times, many in technology don't even know that that is a job that exists. So they are not thinking about the users who look different from them. So it is up to us to have the conversation, get it out there, ask the questions so that we can start to mitigate this kind of digital divide, because you're right, it's going to make the disparities bigger as people go to this more and more if we don't teach them how to do it. So not only challenging the builders, but also learning how to use it ourselves and teaching how to use it is going to be vitally important.
Yeah, and I'll jump over to and I'll answer the second question too. I mean, the how principles. Yes, I will just say that it's very hard to do, and it's often in in building healthcare technology, it's often confused with market research, which is completely not what we should be doing. But that is what is being done right now instead of consumer engagement, which is the right way we should be doing things, where we make sure that we find representations, we include people. It should not become market research, which is how it's done right now. And this basically goes to say that not one perspective is more or less important. I mean, all perspectives are equally important, and I know it's not being done currently, and I don't honestly know a way forward as to how fast it could we could change it. But yeah, that's to answer the question. Patients know when it's a checklist that they're being involved in, or when it's authentic. So patients know when this is being done the right way. I think mixed method collaborations with mixed methods researchers, more collaboration with health literacy experts is the way forward. And being receptive to critical perspectives is the other thing that I learned from this journey of trying to do the consumer engagement. You have to be open to perspectives that you to very critical perspectives.
Yeah, I absolutely agree with everything you've all said here. I mean, the risks here are indeed the amplification, the widening of the divide, right? And how do we mitigate against that? And to Vishala's point, there needs to be a new paradigm in technology development, especially for healthcare, which is very different than other areas where technology plays a role, right? Because of the role of patients in that equation, and because of the ongoing relationship that patients have with their healthcare providers and their health, right? And so that is, and that diversity of perspectives is really huge. And to Tracy's point, yes, and we need people funding this, right? So this goes back to that equitable piece, right? And we also have to move the needle to show that this work is important, right? And, in terms of how to do it, I do not have a blueprint in my back pocket for this. I'm sorry. I wish I did. But what I can say is, when we go back to my slides and think about start sensibly and responsibly and start with a bite-sized chunk. How about, a pilot project where somebody brings in a patient-centered focus, community engagement to do one thing, right? And then we try that with a second thing, right? And if we get a good enough pattern, then we have a blueprint, right? And then we have a playbook that we can start to provide people with. I do hugely worry about, to go to the first question, which I think is still unanswered. I mean, this is a huge problem, right? I'm not going to lie to you, right? I mean, I lose sleep over this, right? I mean, the best we can do is try and make choices to support technologies that are built at least more ethically, right? Like I cringe when people tell me they use ChatGPT, right? Because we know that a lot of that data was obtained very unethically, right? In violation of other companies' terms of use, right? That's been reported on quite a number of times, right? And there are other options like Anthropic and Perplexity and some of these others, right? So make choices. And this goes back to being aware of where AI is being used and what you're using, and surfacing those concerns cross-functionally or making individual choices about what you will use. Right? Many of us don't use Facebook because we think that how they're using people's data and what they've done to, democratic process is not okay. Right? Well, if you want to make choices like that as an individual, you should, right? Because that's what is going to make the difference here, I think, right? And meanwhile, keep an eye on what is happening with government and other standards bodies, and be involved in the some of this, keep an eye on what's happening at Stanford and some of these other places for tracking responsible AI, and follow their lead where you can, right? Like I think that's the best we can do right now.
I think there are two resources I'd like to share in the chat. I think one example I have for the question about examples is academic, so not maybe your mileage may vary. I think the Safe Lab at UPenn has an interesting model of how to involve. They specifically work with Black youth, how to involve community members in data labeling, interpretation, triangulation, and research questions framed around what is going to help people process grief or systemic violence, that kind of thing. That's one link. And then the other link I have, so a tool that I use sometimes is GPT for All. Again, mileage may vary. I don't know about installing it on various systems, but there's ways to run certain large language models locally. And so that, let's say, mitigates, right? You're not necessarily using the like always live service that is using a ton of energy. You're using your desktop, which uses maybe that amount of energy that you've accepted as useful in your life. There's also academic models that have varying degrees of like what of how they collected their data, how they collected their training data. I think one thing that really comes to light for me when I use some of those more open source or more ethically sourced tools, right? They like 100% honest opinion, they are like not as good, right? And it's like the difference sometimes between using like an open source, more sustainable technology versus let's say like Google services for everything. And so often this convenience and this tailor to specific like commercial or professional tasks does sometimes come at a price. And so I think that's one alternative technology to look at among others. But I think we're at the end of time. So I think if I'll open it up if anyone has any closing thoughts, but I think I've appreciated this.
Well,
There we go.
thank you very much for this fantastic panel. There's so much work to be done in this space. I really, really liked the idea that this is more like a puppy. That just kind of struck me and just brought it home really very well. This is the end of day one of HARC. Please remember, you can go and see the posters anytime you like. We have a whole nother day of programming tomorrow. And thank you very much for this panel. I mean, I certainly found it very engaging. And be well, everybody. Hope everything's going well for you guys. And also, you will get an email for the evaluations, and we really benefit from getting feedback about stuff. Okay. Thank you.
Thank you.